The Preble Street Learning Collaborative was initiated in 2017 and is a community-based support system that is entirely devoted to assisting folks that are experiencing homelessness, mental health crises, um, need for connections to the services within the greater Portland area, as well as a very low barrier walk-in medical clinic. My role as a physician assistant was to help staff the clinic along with a handful of other colleagues during periods of vacation, or when their primary provider would call out sick, or when they would have periods of no primary care provider, and we would fill in the gaps for the staffing needs. Um, Mostly my role was to deal with anybody walking in with any medical concern or question, whether that was upper respiratory infections, concern for pregnancy, wound care related to intravenous drug use, abscess, as well as once a month dental and cardiovascular clinics. We also offered medication assisted treatment to those that were seeking to abstain from substance use disorder. So, living in the northern climate during the cold months, the folks that would come in would often be seeking respite from the outdoor temperatures. We had 3 beds and 4 warming chairs. Folks could come and sit and warm up for about an hour or so. Um, while they were there, we would provide them with something warm to drink and something to eat, and blankets, and generally clean, dry socks. The medical folks that needed attention would come in with concerns about infected wounds from using dirty needles, concerns for being pregnant. Occasionally, there were concerns of pregnancy resulting from rape. Um, People would be uh, intoxicated or under the influence of substances, and they would sit in our waiting room hoping to get sober. Sometimes they would not, and we would need to call rescue and have them transported to our local hospital. Um, for the most part, it was some common complaints of headaches, backaches, stomach aches, heartburn, um, and local wound care from wearing wet, cold socks, causing the breakdown of skin. Hands down, I would say, after working several years at Preble Street, the onset of early childhood trauma seems to be the common denominator with all of those suffering substance use disorder. Um, many people come from broken families and never had the opportunity to develop coping skills, or they developed very poor coping skills. Um, that, with the lack of parental support, really led to the breakdown in the ability to, I believe, have hope and think of themselves as people who deserved to have every opportunity that most folks are able to have. I very much remember a story soon after I started working at the clinic where a woman in her mid 40s came in asking for a respite chair so that she could sleep. Um, at that point, it was the beginning of the lockdown for COVID, and our respite chairs were considered not safe to use because they weren't properly socially distanced. One of the social workers then came to me and asked if we could just put her in a chair and let her sleep for as long as the clinic was open. And I then learned that her daughter, who had been taken away from her and was placed in her father's custody because this woman had substance use disorder, um, the daughter had been killed by her father's girlfriend. This little girl was 3 years old, and it was the first time I watched a mom become aware that her daughter had died as a result of her substance use disorder and placing her trust in another couple that had substance use disorder. And I've never forgotten how her crying sounded. Well, I think before I started working there, I had a lot of the answers about why people had their problems with substance use disorder. And I thought if I could just spend some time with people and share with them my perspective, that they'd see the light. Um, After working there, I realized that it's not a lack of discipline that these people have. It is not a character flaw. They aren't bad people. That they were given a raw deal to start with. And several of the clients that I saw were taught to use drugs by their mother. And I'm not sure how you ever get a fair leg up when that's been your experience growing up. So I realize these people really respond to kindness and compassion, and they know judgment from a mile away. And the difficult part for me, being a medical provider, was hearing their reluctance to go to the hospital, because they feel that when they go to the emergency room, they are judged from head to toe. And it prevents them from seeking medical attention when they really need it, which means everything gets terribly worse before they actually go and get treatment. And at that point, things are so sick and they're so unwell, and they need to spend more time in the hospital with fancier medications and treatments. And that's all because they feel judged. And that's what I realized, is that they are just like everybody else. They have just had a tremendous amount of hurt and fear, and they don't know any other way. Well, I hope that there's more formalized training on all disciplines, on all levels throughout the medical community. When in school 30 years ago, there was absolutely no training about anyone with substance use disorder. A little bit about alcohol use disorder, in terms of helping somebody detox or avoid withdrawal, but nothing for opiate use disorder. And I think that the longer we're in this crisis, that all ancillary staff, from ultrasound techs to those in radiology to housekeeping, that everyone understands that people that are sick and have substance use disorder, they have very little trust in the medical community. And if we can continue to treat each person as a person with a medical illness while they are in the hospital, and that they are treated kindly, respectfully, like everybody else, I think that the reluctance to seek medical care when needed, I would hope, would go down, and we would have better outcomes. And with more people being trained on what this disorder involves, it will inspire others to go into those fields that can continue to help people and get in early before the addiction takes hold.